Hello, and welcome to the County of Santa Clara Employee Benefits Retiree Medical Enrollment Session. Please mute your computers and cell phones. Congratulations on your upcoming retirement. As a county retiree, you will be entitled to certain benefits in retirement depending on your age, years of county service, and where you will reside in retirement. For retirees who qualify, the county offers medical insurance benefits to retirees that are similar to medical benefits that you receive as an active employee. We offer HealthNet, Kaiser, and Valley Health Plan. If you will be living outside of California in retirement and would like to keep county-offered coverage, the county offers HealthNet PPO and HealthNet FlexNet. Alternatively, the county also offers a payment in lieu program if you'll live outside of California, where you may receive compensation instead of medical insurance. For Valley Health Plan, the county offers 2 levels of insurance to retirees. We have a classic plan and a preferred plan. Classic and preferred refers to the VHP HMO networks. The classic plan is the same network that is available for current coded county employees who are enrolled in VHP. The preferred plan is a smaller network that includes VMC and a few local providers. However, it excludes Palo Alto Medical Foundation and some Sutter Gould Medical Foundation locations. Dental and vision benefits are not included in this package. You may elect for dental or vision COBRA coverage upon retirement, which you would need to pay for out of pocket. Slide 5. Your medical insurance as a retiree will begin the day after your medical coverage as an employee ends. This means that there will be no lapse in your health insurance coverage when you transition from an active employee to a retiree. This transition occurs on the last day of the pay period of your retirement. Also keep in mind that the effective date of your retirement is the day after your last day of work. As an example, let's quickly walk through a calendar to illustrate how these dates interact. Your employee medical coverage will continue through the pay period in which you have hours logged into the payroll system, either through working, vacation, or any other type of paid hours. Your retiree medical coverage will begin at the beginning of the following pay period. As an example, let's say your last day of work was on December 22nd. Your employee medical coverage will be effective through the end of that pay period, which is Sunday, December 27th. If you are currently in Kaiser, you may receive a letter from Kaiser stating that your coverage is terminated. Don't be alarmed if this happens because it's only referring to your active employee coverage. On Monday, December 28th, whatever you elect for your retiree coverage will begin. Your retiree coverage will be in effect until you either make a new election or if you become ineligible for that plan. As a retiree, you'll have the option of electing a new health plan once per year, similar to how open enrollment works as an employee. However, as a retiree, you may also have another opportunity to change your plan as well, such as if you move out of the service area or state. Slide 11. The county currently contributes up to $758.34 per month toward medical insurance premiums, which is the cost of the under 65, that's age 65, Kaiser single coverage plan. So what this means is if you are under 65 and you would like Kaiser coverage for yourself only, there is no premium cost to you. The county will cover the full amount. If you are under 65 and you enroll in VHP or HealthNet, The county will pay $758 towards the cost of those plans, and you would be responsible for paying the remaining balance. You can also elect to enroll a spouse or other qualifying dependent under your retiree medical plan. Again, the county would cover up to $758 per month, and you would be responsible for paying the remaining balance. To find out the exact cost of each plan, you will need to contact your assigned HR representative. You may already be in contact with this HR representative, but if not, please stay with us until the end of this presentation and we can let you know who that assigned HR representative is. Slide 12. So again, if you are electing VHP or HealthNet, or if you would like to add dependents under your retiree medical plan, there will be some out-of-pocket costs involved. To pay this cost, you must pay it on a monthly basis through the CalPERS Direct Authorization Program. What this means is that the cost of your medical plan over $758 will be deducted from your pension check each month. However, since this can take a few months to set up through the CalPERS system, the county requires anyone who has a cost, that is, anyone enrolling in VHP, HealthNet, or has dependents, to pay for the first 2 months of retiree medical premium through a personal check. There should have been a form in your packet to authorize the CalPERS deductions, but you can contact your HR representative if you need an extra copy. Slide 13. When you or your spouse turn 65, you should contact us right away, and your HR representative will walk you through what must be done. In fact, it's good to contact us a few months before you turn 65. 2 things change when you turn 65. First, the health plans that I previously discussed will see a reduction in cost. This is generally advantageous for you because your medical coverage premiums may go down or they may be eliminated completely. Secondly, the county may also be able to reimburse you for the cost of your Medicare Part B premiums that you'll be paying to Social Security. Not everyone is eligible, but let us know and we can speak to you individually to determine your eligibility. In addition to contacting the county's benefits office, when you turn 65 or a few months before you turn 65, you should also contact the Social Security Administration at 1-800-772-1213. Slide 14. It's also important that you keep in contact with our office if you have certain life event changes. Number 1, anytime you change your home address. This is important because your address may affect your eligibility or the cost of your health plan. Number 2, if your dependent passes away, please let us know. You should also designate a representative to contact us if you were to pass away. Number 3, if you wish to remove a dependent from your coverage. So if the cost of coverage for a dependent is too high and you don't have to wait for open enrollment, you can remove dependents at any time. Slide 15. Open enrollment is the month of May each year. During open enrollment, you can change your health plan or add dependents. Just like when you are an active employee, any change that you elect during open enrollment will be effective on July 1. There are certain qualifying events that allow you to change your plan or add dependents outside of open enrollment as well. Please contact your HR representative within 30 days of a qualifying event to make that change. Some examples of qualifying events can include things like marriage or a change of address. If you're not sure, please contact us. and we're here to answer your questions. Slide 16. Some of the benefits that the county offers to active employees, such as life insurance, can be continued at your expense in retirement. If you're interested in this, the name of our administrator is The Standard. Please contact them directly at 844-289-2310. Slide 17. While the county does not offer dental or vision coverage, we have compiled a few recommended resources if you wish to enroll in new coverage. Contact RPEA AARP Delta Dental in California or Covered California for more details. If you decide to go with coverage through these providers, they will require proof that your employee coverage has ended. We provided the form that they will request in your packet. It is the last page on your worksheet. If you don't see it in there, again, please contact your HR representative and they can provide you another copy. Slide 19. Within 30 days, you will receive a notice in the mail from Navia Benefit Solutions regarding COBRA. COBRA is available as a temporary benefit to continue the same benefits that you currently have as an employee in retirement. You or your family would be responsible for the full costs of the premiums plus an administrative fee. Please note that in relation to COBRA, most retirees may not need that if the only thing you are looking to do is continue your health coverage, because again, the county covers the cost of Kaiser, the $758 in retirement. Slide 20. Fidelity, our plan administrator for 457, can go over deferred compensation with you in further detail at the end of this presentation. What I do want to note related to deferred compensation is that if you want to defer your final paycheck, you need to submit that request on Fidelity's website a month before you retire. Many retirees do elect to increase their contribution to their deferred compensation on their final check, because remember, your final check will include any vacation or sick payouts that you may have. Please note that if you work, let's say on December 31st, and your paycheck arrives in January, that will count for your the January tax year. Slide 21. Your final paycheck will not be direct deposit. You'll need to make an arrangement with your department to pick up your final warrant or to have it mailed to you. If you are an HHS employee, you'll need to contact the cashier's office regarding your final warrant. Any payoff will be withheld as specified by what you elect on your tax forms. Slide 22, Employee Assistance Program. We offer EAP counseling services to retirees for 1 year after retirement. Retirees are entitled to 5 free sessions. Slide 23. If you are interested in using some of the skills that you may have picked up while working, the county is looking for volunteers for the TOPS program. For those of you who may be unfamiliar, TOPS stands for Training for Office Professionals. More information can be found on this slide. The contact number for this program is 408-299-7400. Slide 24, Summary Recap. A few important points here. Please let us know a few months before you turn 65. You will need to enroll in Medicare Part B, B as in boy. Please do not enroll in Medicare Part D, D as in dog. So you'll only enroll in Medicare Parts A as in apple and B as in boy. Kaiser Senior Advantage. Kaiser Senior Advantage is the name of Kaiser's Medicare coverage. You cannot have double Kaiser Senior Advantage coverage because Medicare Part B cannot be assigned to two different plans. Slide 25. So again, the county's benefits department will be here for you even in retirement. Contact us when you enroll in Medicare Part B or when you or your dependent turn 65. Contact us if you move. Your address may your health plan eligibility. Contact us if you have any status changes or life changes that may affect your benefits. For example, when adding or dropping dependents from coverage. We are located at 400 Race Street, Suite 201 in San Jose, California, 95126. You can reach us by phone at 408-970-2600. Alternatively, you can email us at benefits@esa.sccgov.org. You can also email your HR representative directly. Your HR representative should have provided to you your retiree exit interview packet. This packet contains the medical insurance enrollment forms as well as much of the other information that I have gone over with you today. If you have not yet received this packet, please contact your HR representative. Stay until the end of this presentation and the presenter can provide you with your HR representative's contact information. Slides 27 and 28 are examples of some of the worksheets from the packet. There are several places that you will need to sign. After completing these, send them back to your HR representative. So this concludes this section of the presentation. Congratulations on your retirement.